This program is proudly brought to you by Drugnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, supported by Seafort, your best vitamin C supplement from Samuel's Pharma. It's another beautiful week, and we are more than excited to come your way with another thrilling and stirring episode of Ask Your Pharmacist. My name is Peggy Samuel. This show is proudly brought to you by Drugnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, supported by Seafort, the best vitamin C plus zinc supplement from Samuel's Pharma. Many thanks to our media sponsors, ETV Ghana and GH1 Television. We will take a quick break. I will come back, introduce our guest pharmacist, location, and our topic. Stay seated. Do not go anywhere.
Are you tired of roaming for your medications and can't find them? Sick and alone and can't get anyone to get your drugs? Do you need to talk to a pharmacist? Or do you feel uncomfortable when buying certain drugs from the pharmacy? Do you want your drugs to be delivered to you at the comfort of your own home or office? Then it's time to download the Drugnet app, spelled DRUGNET, from the Play Store or the App Store to enjoy total convenience. Use Drugnet, your #1 online pharmacy. For further inquiries on Drugnet, call 024 00 24455.
Thank you so much for staying tuned. You are watching Ask Your Pharmacist, and today we are at Kokomlemle, and our guest pharmacist is Farm Dr. Seth Kweku Ofei Jr. He is a pharmacist at the Kolebu Teaching Hospital, and our topic for discussion is asthma and inhaler techniques. Farm Doctor, how are you?
I'm good, by God's grace. How about you?
Very well, thank you. Okay, so why are we doing asthma, and what is it about the inhaler that we need to learn more about?
Okay, I think asthma is a chronic inflammatory disease that usually affects the lungs. And you know that many people, studies have shown that about 26% of people who even after expert training are not able to use their inhaler techniques rightly. So I think it's important that the public know what asthma is and how they can appropriately use their inhalers to help them. Yeah.
Well, as you heard, it's very essential. You stay tuned and watch more. Thank you.
And now you can asthma yare na question men offer asthma wa opese ubisame.
Dedi kan me da se. Asthma yare me pese me bisa ho question ni se. E de ani de na wo ya unya asthma ana se asthma no ye de wo.
Okay.
Eno ana pese me.
Nti medical eyi question a tosimi no ano. Na asthma yade a ewobusuam nti yetumi ede wo zide tie ne se o maame ewobi ana o papa ewobi a a higher chance say ubetumi enya asthma ni bi na afi nso bi wo ha na asthma no so na osua no ebia no onye bibia ebetumi de asthma na ba na emo so onyini a na bia emmo wanketenkete bi ana ade bia oye allergic to ana even exercise mpo ema no eya etumi de ne asthma na eba nti weni nyama etumi de asthma neba enyam bebrebu ha enro bi ha from NSAID diclofenac ya toto of pharmacy no and even sometimes certain eye drops bi ha use a etumi de ema o asthma no e den e trigger ma asthma no eba efi ene ade enyam bebre e ka ho etumi de wo asthma no e den eba. Okay.
Okay.
Miss Medase.
Yo, my question is 2 in 1. The can say asthma yare no ye wo herbal treatment aye de sa sanse da bia utie radio ne ya ana ye wadro ye herbal ye wo herbal dro de sa asthma. 2 asthma no eye wa etimi kokora emabium ana say yare bia e ba wo so a ye manage keke na ye ntu ase.
Okay, so medical answer a question from the second one. O person who say asthma na yade you two asiana. Na asthma no eye potokasem you be can say asthma a chronic disease. Into na asthma yade about so ye di enru e manage. Na enya ade a ye betumi etu asia kra. So utumi manage ni year. Utumi tena be 20 years, be 10 years, be 5 years na unya symptom bia emba krada. Na afenso no wo sa bisa say Mimindro ade a yetumi de sa asthma na no kra yebetumi yusu mimindro ade asa yare bi wo ho na even abrofduro a ye use no bi wo ha no mo de mmiduro na eye but ye bibire mu ase no mmiduro ye duro a omo hyada steady ana mo nsu ho ade enkoni mebre nti bi ha na ye ntumi enkyere se ebia na bibiduro we betumi ade betumi aboa esan enimdie na won na eswa afen so bibiduro na bibiduro ha na etumi ha ye kidneys na abrofduro ne duro a almost steady ache I nhwem bebre I betimi ade inside see abo aka say we no ade a we use so I betimi abo netimi asthma no anu anasa abre na ase nti answer no
Dr. Midasi.
So my question is, can excessive laughter make one trigger the asthma
Okay. Yes, it can. We have emotional triggers, and with emotional triggers, these are factors or triggers that could, precipitate your asthma. And with emotional triggers, we are talking about laughter, like you said, which can rightly trigger your attack. Even sometimes crying, can trigger your attack. So emotional factors could be a trigger for your asthma. So as humans as we are, you can't say you won't laugh or you won't cry. Sometimes you could do that. But if your asthma is well controlled or asthma is being properly managed, then sometimes you can laugh and you can cry. But then when we have excessive form of the crying or the emotional factors and your asthma is not properly controlled, then it could be a triggering factor for your asthma.
Nti ono ko school no kwano so feeding program no mo ye no school me to me monitor aduane odi ma ne de na ba bonsa ma nanim ahụhụ ne kata achi no ansa asthma na yi no me to me monitor na me hu aduane odi a de brand.
Nti definitely I was say Obana woni no ofie ndie definitely odidi ofie nti I was say nnuane bi wo ha otimu say nnuane we no odi a eden asthma ne den eba na afin so ko school no I was say odi ne teacher for edi nkomo na oka che ne say Obana e asthma na nnuane bi wo ha odi a etumi de ne asthma ne ba na mo so ma hwe say nnuane we ni dia odi a eden asthma ne ba sa no mu hu a omo so ma Obano sa nnuane no e ma ne nkofa ne asthma ne emma nti also wa so odi we ni to form na hwe Obano na asthma ne ba why we prevent no one say the anyway no the asthma neba.
Coffee now wo he a sharp on to na see o.
Me do me yare o na my renti mintimi mpiem koto aduro.
O coffee and na wo ha wo ho. Wo betumi ato wo no nyina wo Drugnet app no so a wonto wo nan.
Drugnet?
Ah, ne Drugnet. Me ha me ho bi ewo. No one say mako app no so na ma kire nra me hia nyina ana ma Your Pharmacist no na ma jimani odi nro no nyina bebre me na waje me 5 cedis pe
eni jesem we di ama me ho atomi bodada
emra so also download the Drugnet app free Google Play Store and App Store na nya ahotoso papa bi Drugnet app there for the tombia edi kan kra.
Watching Ask Your Pharmacist, and we are still discussing asthma and inhaler techniques. It's time for our social media questions. And from Doug, the first question is, can excessive sports or sex trigger an asthmatic attack?
Okay, thank you very much for this interesting question. Excessive sex or sports could trigger an asthmatic attack. So we are saying that when you have excessive exercise or sports, it could be a triggering factor for your asthma. However, exercise in general is good for patients who have asthma, and even studies have shown that swimming actually helps people who have asthma, and it helps them to have their asthma well controlled. So it depends on how you look at it. Excessive could be detrimental, and then whilst it has the overall benefit for people with asthma. That's the question. The same thing applies for sex. When the patient has asthma and is having sex, it could be a triggering factor for their asthma. It doesn't mean that asthma patients cannot have sex. They can go ahead and have sex, and that will be fine for their health.
Okay, so it could be detrimental, but do not overdo it. All right, so the second question is, how common and how deadly is asthma?
Asthma is very common in the sense that according to the WHO, about 300 million people are affected globally with asthma, and about 50 million people have asthma in Africa. According to their latest publication that they did in Ghana in the year 2018, about 1,400 people died from asthma. So asthma could be deadly if it is not well controlled.
Okay. Wow, there you have it. It can be very deadly. So make sure you always speak to your pharmacist to give you the right options to manage your asthma. Alrighty, so today we are talking about asthma and inhaler techniques. First of all, Farm, when we say asthma, what is it?
Asthma is a chronic infection and that affects the lungs. Usually it also causes obstruction of the lungs, so that's what I can say about asthma.
Oh, okay, that's pretty straightforward. All right, so let's touch on the risk factors. What are the risk factors?
Okay, some of the risk factors of asthma are family history, gender, occupational exposure, sometimes physical activity, obesity, among others, can cause asthma or be a risk factor for asthma. Sometimes we can even have medication will not cause the asthma per se, but these medication that we call NSAIDs and beta blockers can trigger your asthma and make it come. So once you have asthma in your family, you are at a greater risk of also having the asthma. Yes.
Okay, so basically you have to find out from your family if there is any asthma history, and since you are more susceptible to having it, then you probably have to get that checked as soon as possible. All right, so let's touch briefly on the signs and symptoms of asthma.
Okay, there are 4 main types of signs and symptoms of asthma. You have your breathlessness, you have your wheezing, you have your coughing, and sometimes you can have your chest tightness. These are some of the 4 classical signs of asthma that most people who have asthma present with.
Okay, so can it be all of it at the same time, like, you know, the wheezing, coughing, or it might be just one particular symptom you might be experiencing?
You could have all of it at the same time. You could have 1, you can have 2, you can have 3, so it depends. Yes.
Okay, wow. That's very educating, viewers. I really hope you are learning a lot about this. All right, Farm Dog, so let's talk about asthma and triggering factors.
Okay, so some of the triggering factors of asthma, I said, could be physical activity or exercise. It could trigger your asthma. Sometimes people who are exposed to smoke or people who smoke can also have, could be a trigger for asthma. And the people who put on weight, or we say obesity, are people that can also be a triggering factor for asthma. And the person, depending on the occupation that you find yourself in, could also impose as a trigger for your asthma. All right, so is asthma very preventable or it can be managed? Asthma can be managed. Asthma is not something that you can cure, but you can manage your asthma. I've come into contact with patients who have asthma and their asthma have been well controlled, and in about 20 years or 25 years they did not experience any symptom at all. But then when the patient went back to some of the factors that triggered their asthma, then their asthma came back. So you can very well control your asthma for even a long period of time. Okay, Farm, so I have a question. I know of a case where a kid was born with asthma and apparently was treated with some herbal, products, and the kid is not experiencing that anymore. So is it to say that it's being managed, because up till the kid is probably like almost 25 and the person is not experiencing? I would want to think that has been, taken care of. What do you think about that? Okay, some herbal products could be beneficial for the controlling of asthma symptoms, and we have something we call controlled asthma. So if this herbal product is very beneficial and it helps and it's able to control your asthma, then you can live a very long time without experiencing the asthma symptoms, and that will show that your asthma is being controlled and the herbal product that you may be using is helping the child. Okay, so aside inhalers, are there any supplements you can take? What can you do? Like, I know a lot of people don't want to use inhaler because they have the assumption that once the inhaler is not present, you might die. So what can you do to prevent all of that? Okay, mostly asthma is a disease that affects your lungs. So usually the medication have been designed in such a way that once it has been designed in the inhaler form, so you have the metered dose inhaler, you have the dry powders inhaler, among others. So this medication has been specially designed such that when you inhale it, it's able to go directly into your lungs and able to perform its function, reducing the inflammation and obstruction that occurs in your lungs. So inhaler is the cornerstone of the treatment of asthma. So you can't do away with it, inhaler, and it helps. The other tablets that they use, which also helps for their treatment of the asthma or controlling the asthma. Okay, so since we're talking about inhalers, can you demonstrate how we can use inhalers to manage our asthma? Okay, thank you very much. Okay, so this one that I have in my hand is called Ventolin, and it is a beta agonist. So what this drug actually does is that it goes into your lungs and open your airways so that air can freely flow into your lungs and get to your other organs. So with a metered dose inhaler, you just have to remove the cap. Sorry about that. You just have to remove the cap like this, and you shake for about 5 seconds. You shake for about 5 seconds. So if you have to shake it, you have to shake so that the drug will be evenly dispensed in the canister. So what happens is that if the inhaler has been used for a long time, or it is a new inhaler, you have to prime. By priming, I mean that you have to press the canister so that the medication will come out. So this is it. You can see it's coming out about 3 times. So after you've done this, you just have to bring the inhaler to your face like this, and go away from your inhaler and try to exhale to breathe out deeply. So after that, you have to put in the inhaler in your mouth. So when you put it in the inhaler in your mouth, you press from the top, the canister, you press whilst you inhale. So that's the technique, that's the difficulty with this inhaler type. You have to be pressing whilst you inhale at the same time. And once you are done, you have to hold your breath for about 10 seconds or as much as you can. Then you can exhale out slowly or gradually. You get it? And sometimes when the metered dose inhaler is one that has other drugs like steroid, you'll have to wash your mouth or brush your teeth so that you can prevent certain infection like your oral tract, among others. Yes.
Okay, so can you overdose with any inhaler?
Overdose, yes, you can overdose with the inhaler, technically. But then with the inhaler, usually 2 puffs, or when you give 2 puffs, you'll be okay. Okay, yes, so you don't want to go and give more. It's just like any other drug. You don't want to overdose or don't want to underdose.
Okay, so I would want to presume this is not an over-the-counter medication. How do you get an inhaler prescribed to you?
Okay, once you have asthma and it has been diagnosed in the hospital, the doctor can prescribe this medication for you. And once it gets finished, you can walk into the pharmacy either with your prescription or with the box or the medication, and you'll be safe. Okay, but it is not an over-the-counter medication.
So you still have to talk to your pharmacist. Then your pharmacist will be able to help you pick up the right inhaler to manage your asthma. Thank you. Dose for Healthy Living is up next. Stay seated. Today on Dose for Healthy Living, get regular checkups. Some diseases don't show up as symptoms until it is too late. Get regular blood tests for blood sugar, blood pressure, cholesterol, along with urine tests. If the test results are not optimal, that means that you can quickly take corrective actions. Many thanks for watching Ask Your Pharmacist. I really did hope you learned a lot about today's episode. This show was proudly brought to you by Drugnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, supported by the best vitamin C plus zinc from Samus Pharma, Vitsi Fort. Many thanks to our media sponsors, ETV Ghana and GH1 Television. Like I always say, whatever that goes inside of you is merely irreversible. That is why you always have to ask your pharmacist before you swallow anything medicinal. Stay safe. I'll be coming your way same time next week. Until then, be safe and bye-bye.